of which 1,615 were positive. And in the month of June to date, we've tested 85,142 samples, of which 4,049 have turned positive. And from these figures, it is clearly evident that the number of those testing positive has been on a sharp increase. And this really should worry each and every one of us, because it's obvious and it's a bad indicator that the situation is getting worse within the country. And it is important, again, as we've emphasized over and over again, to ensure that we adhere to the containment measures. And even as we do this, it is important to note now that the fight and the frontline soldiers, in terms of spotlighting, has turned to the counties. And the counties now need to bear responsibility to be able to ensure that we are able to combat coronavirus. And to this end, counties need to move with speed to finalize their levels of preparedness. As of now, working together with county governments, we are working to enhance capacity of testing, tracing, treating, and isolating. And as we move forward, we do expect each and every county government to be able to roll out this intervention, to be able to enhance their testing capacities at county level. And this includes both laboratory testing, but also syndromic surveillance, to be able to have proper contact tracing mechanisms in place. County governments need to deploy rapid response teams. These teams need to be agile and they need to be able to be supported to ensure that they can trace appropriately. And of course, treatment facilities need to be readied in terms of being able to receive any sick or severe patients and ensuring that our isolation and home-based care program are efficiently run. In the meantime, we would like to continue urging each and every one of us to continue, again, seriously observing all the containment measures. And to remind people that really there is no alternative strategy. There is no other mechanism in place. As we've said time and time immemorial, it is up to us to be able to wash our hands, to maintain physical distance, and to be able to mask. Those really are the alternatives or the measures that we have in place right now. Another key element that we feel we must emphasize is that it becomes very important to have personal responsibility as each and every Kenyan, and therefore expecting law enforcement agencies to compel us to observe these measures can only help in creating an environment where the virus will thrive and get out of control. There are those of us who only wear the mask when in the vicinity of law enforcers, only to remove it immediately after. And there are those of us who actually also don't wear the mask correctly. And there are those of us who have very low regard to the social distance requirements. And it is important to know that this, again, is a recipe of disaster, and we really do have to take personal responsibility. Turning on to our COVID-19 situation, today we have tested 2,718 samples, out of which 259 people have tested positive for the virus. The cumulative number of tests conducted so far stands at 196,000, and the total caseload for the country right now is 6,070. So we've now surpassed the 6,000 mark. All the positive cases are Kenyans, except 3 foreigners, 159 being male, 100 being female. And in terms of age, the youngest is 8 months old, whereas the oldest is 92 years.